just correlate the embryological structure of the diaphragm. Actually, everybody should go through this table. This is very important that you should have an understanding of the components. So, if I am talking about just a quick revision of it, septum transversum is forming the central tendon of diaphragm. Pleuroperitoneal membrane is forming small peripheral part of the diaphragm. The dorsal mesentery is forming the cruras, and the mesoderm of body wall, if I talk about it, is forming the larger peripheral part of the diaphragm. So this, if I am talking about the mesoderm of the body wall, this is forming the part which is lying external to that part of it is external to the part which is formed from the pleuroperitoneal membrane. So, done with this. Now, let us discuss the nerve supply. So, if I am talking about the nerve supply, we already know in the gross anatomy we have discussed that the nerve supply of diaphragm is from C3, C4 and C5. Now, during intraembryonic life, that is 4th week of intraembryonic life, the septum transversum is located in the cervical region opposite 3rd, 4th and 5th cervical somites. So, opposite which cervical somite is it developing? 3rd, 4th and 5th cervical somite. So, that is the reason the innervation is, corresponding to C3, C4 and C5. Now, if I talk about the phrenic nerve root value C3, C4 and C5, it reaches the diaphragm through which fold? Pleuroperitoneal fold. Later on, what happens by 6th week of intrauterine life, the diaphragm descends more caudally, and now it is at the junction of thorax and abdomen. It is at the thoraco-abdominal junction opposite to the T7 and T12 spinal segment, but still the innervation is from C3, C4 and C5.